the vaccine committee that advises the Centers for Disease Control and Prevention is meeting this week, and new members of that committee have sowed doubt in vaccines, raising major concerns from the medical field. It's one of the most influential committees for the country's health, but this year it's also a hotbed of controversy.
It looks as though the current committee in its current function is losing its credibility.
Recommendations from the Vaccine Advisory Committee are typically followed by the Centers for Disease Control and Prevention, so they are important when it comes to what vaccines people around the country take. This fall, in a move slammed by several doctors' groups, the panel did not recommend COVID-19 vaccinations, instead making it a personal choice. Earlier this year, Health and Human Services Secretary Robert F. Kennedy Jr., a vaccine skeptic, fired the committee's 17 members and replaced them with a group that includes several anti-vaccine voices. Now, the panel will take up hepatitis B shots.
There are no new safety issues that have come up. Why they would want to disrupt that in any way is a puzzle to me.
And potential changes to the childhood vaccination schedule.
This is a vaccine schedule that ACIP and CDC and HHS, under Republicans and Democratic administrations alike, have all supported because it's based on science.
There's no reason to delay or space out vaccines. Doing so just puts children at risk.
The meeting comes amid even more changes at the committee, which is not fully staffed. Monday, Kennedy announced the committee's chair, Dr. Martin Kulldorff, would take on a new role at HHS as a chief science officer, saying he's made the committee one that delivers, quote, gold standard science for the American people. Kulldorff's replacement is another controversial figure. Dr. Kirk Milhone is a pediatric cardiologist who said during a 2024 congressional hearing that an increase in cardiovascular disease in older teens and young adults should be attributed to vaccines. The scientific community rejects that statement. A 2021 medical report found cardiac inflammation after COVID vaccination is rare and temporary. Now, this all comes amid sweeping changes at the CDC, which currently does not have a permanent leader. Last month, the agency changed its website to include false claims that link autism and vaccines. The agency was directed to do that by Secretary Kennedy, who is not a doctor.
There's been so many changes at the country's health agency. How is this impacting potentially vaccine rates? What do we know?
Yeah, so there was a report done by the CDC over the summer, Tim. And remember, the concerns raised about vaccines, this vaccine skepticism, are not new this year. That came up during the campaign as well last year. But this report in the CDC did find that vaccine rates are dropping for kindergartners. And so there's a lot of concern out there that vaccine rates are dropping, could drop for children. And that is something that the American Academy of Pediatrics raised earlier today. Take a listen.
These families who are not following this very closely, they hear the headlines, they hear there's controversy around vaccines, so they want to wait. I'm hearing that from a number of colleagues. So it's having damage in real time.
Yeah, and so look, there are a lot of impacts if you see lower vaccine rates in terms of the diseases that may emerge. Obviously, we have seen a pretty significant spike in measles cases around the country. Keep in mind, the American Academy of Pediatrics puts out its own vaccine recommendations. They've been doing that for a while now, and they are stressing that amid the controversies that are playing out at the Vaccine Advisory Committee for the CDC.
Thanks for watching our YouTube channel. Let Spectrum News be your resource for balanced, in-depth political coverage. And click the subscribe button here. You can also download our app and watch us on TV to learn more about the candidates, where they stand on the issues, and more. We'll see you then.